Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. Today, super pumped to have Dr. Kirk Gair on the show, and we're talking all about cold laser therapy, which is Dr. Gair's one of his specialties. He trains doctors and practitioners all around the world, actually, in using cold laser therapy for healing and treating a number of health conditions. I honestly don't know much about cold laser therapy, so I'm excited to jump into this topic that I've heard some about, or you may have heard the buzzword cold laser therapy, but what it really is, and understanding how to use it is what we are diving into. So Dr. Gair, thanks so much for coming on the show. And if you could first give us a little bit of background about who you are and what got you doing the work you're doing in the world.
Sure. So I'm a chiropractor. I also, like you said, I specialize in low-level laser therapy, functional medicine, and functional neurology. I got into chiropractic because I had a severe back injury when I was playing high school football, where I collapsed on the field. It felt like someone put a jumper cable on my low back. I was in major spasms, 10 out of 10 pain. I don't remember getting from the field to the locker room. I just remember being on a table and spasming, and them taking me to the orthopedic doctor, and he wanted to do surgery on me right away. He wanted to remove my discs and fuse my vertebrae. And I was 16, and he told me I was never going to play sports again. And if I tried to, I'd be crippled and in a wheelchair, and I was going to have to learn to live a sedentary life and be on pain medication for the rest of my life. And that just wasn't acceptable for me. So I went to a really good sports chiropractor, and he fixed me up, and I was able to keep playing. And I played high school and college football. And I thought, man, this would be really great if I could go and then help other people the way I had been helped, because my life could have gone in a 180 different degree difference on there of being, sedentary, possibly in a wheelchair, in pain every day, versus being active and enjoying life. So I went to chiropractic school, and one of my claims to fame is my classmate was Dr. Tatis Karajian, who a lot of your listeners probably know of. And he and I were good friends. And when we were in our second term, he was so far ahead of his time that he actually ran labs did an interpretation of my labs on me and gave me nutritional protocols and whatnot. So he was already doing functional medicine in 1996. And so I was his first guinea pig. After I got out and graduated and started working on patients, I was curious in that I saw some patients would get better so much faster, some pro athletes. So I thought, well, what are they doing that's different than what I'm doing with traditional chiropractic? And that's when I discovered this Dr. Jeff Spencer, who was doing laser therapy on some of the top athletes in the world at the time, not only for injuries, but for performance enhancement. And so I went to get training from him and learned from him what he was doing, and then founded all this research that was going back many decades of what lasers could do beyond just sports, but what it could do with immune support, with the brain, with helping even things like cuts and burns and broken bones heal faster. And I was blown away at this level of research that nobody knew about. This was in 2004. So I got started with laser therapy back then, and everybody thought I was crazy. They're like, what those voodoo lights that you're using? Mm-hmm. What's this weird stuff you're doing? And so I started working with it with a lot of different athletes, even pro athletes and Olympic athletes, and then also with autoimmune patients. So I got featured in Dr. Isabella Wentz's Thyroid Secret and her Hashimoto's Protocol book, because some of the stuff I did when my wife had a severe Hashimoto's reaction that almost killed her. And we used laser and combining that with what Dr. Karajian taught us to help her recover. And so I've been teaching this to doctors, around the world. And it's great that now people are starting to become a little aware of it. They hear more of say light therapy or red light therapy. And they're starting to get curious about what it can do. And so I have a private practice that we help a lot of patients with as well.
Yeah, that's such a cool story. I love it. Just how
Thanks.
Life takes you on a journey where you probably didn't grow up saying I'm going to be an expert in cold laser therapy. No. As a kid.
I never thought of that. I never thought I would be doing webinars where I have doctors tune in literally from Russia, the Middle East, South America, Australia, and Hong Kong, and where I'm doing them in 2 languages. So, some in English, some in Spanish. It's just, it's amazing kind of what the plan is for you that you can choose to jump in on or not.
Yeah. Well, tell us can you define cold laser therapy?
Sure. So when we look at cold laser therapy, that means it's non-thermal because there are some lasers out there that are thermal. Like there's some high-powered ones that work by heating up the tissue. The low-level lasers, they've been used since the 1960s, and they were really pioneered in the former Soviet Union, where there was so much research by 1974 that the Russians were using them in their state-sponsored medical care. So they were using them for every branch of medicine, basically, even if it was OBGYN, if it was oncology, neurology, orthopedics, because they were able to see that it could help people to heal much faster by the way the laser actually stimulates some changes, what we call photobiochemical changes. So the easiest way to think about lasers, let's start with plants. Let's look at photosynthesis. So you've got a plant's leaf, and when sunlight hits the plant's leaf, they will absorb the photons of energy. It sounds kind of like Star Trek, but it absorbs those photons, and then the plant will convert that into food through photosynthesis. So that's one simple way that, living organisms can use light. In humans, when sunlight hits us, we can't make food, but we can absorb that energy and make, say, vitamin D that goes throughout the body in order to cause you to make stronger bones or affect the immune system and inflammation, or the sunlight can cause you to make melanin for a suntan, melatonin for your sleep and wake cycles. And for some people, they can even get seasonal affective disorder where if they don't get enough light, they can get depressed. So we know that our bodies are already light reactive. Now, what happens when we get laser on the skin, you're not going to make food or vitamin D or melanin, but you're going to make some other molecules that have a really powerful impact. One of the primary ones is you're going to make ATP, which is made in the mitochondria. And so if you have listeners who have autoimmune conditions, fibromyalgia, which is very common, especially in females, where they have issues with their mitochondria, the laser supports that by helping it to make extra energy, extra ATP. And that can affect every single cell in your body, even brain cells as well. Another big thing you're going to get with lasers is you're actually going to make stem cells. And you see a lot of stuff online, people talking about regenerative medicine and stem cells, et cetera, which can be expensive. The great thing about lasers is it's not as expensive, and you can actually make your own stem cells to whether it's helping to repair a bone or an injured muscle or a cut, or let's say a concussion. It can help with all those things. You're also going to make some other molecules that anybody who really follows things with autoimmunity with Dr. Karazian will know are very important. Like you're going to make nitric oxide, which causes blood vessels to dilate and improves blood flow, and also glutathione that helps to support your antioxidant pathway. And those two molecules are also very important in dampening autoimmunity. So we see a lot of these different things, and there's even studies for sports performance, studies for thyroid, for it being able to even help to regenerate some of the tissue that's in there and dampen the antibodies. It's just absolutely mind-blowing when you look at all the research of what low-level lasers can do, especially without really any side effects. That's one of the wonderful things you get with them.
I mean, they sound like a panacea for
It does. It really does. I mean, it can sound like snake oil. But if you go on to PubMed and you look at the research articles that are being published, there's literally over 8,000 articles that are on low-level laser. We're actually going to be doing a study at my office too on some new types of lasers as well. So it's really exciting, an exciting time to be involved in with this, and also for patients because they have some options that weren't available to them previously, particularly even with autistic kids. The lasers that I use from Erconia, they just completed a quadruple blind study on autistic kids where they compared it to a placebo. The placebo was an LED device, and they had these kids go through 8 sessions of laser on the head and compared them pre and post, and did a follow-up even 6 months later. And the kids had profound changes in their behavior and their ability to focus compared to the LED group. And they even then crossed them over later and gave the LED kids the laser, and you see some amazing changes. So it's exciting that you could do some things with conditions that we previously didn't think there was as much hope for.
Yeah. Is now when a person is using laser, is it something that like the changes can stick, or do you have to keep using it?
Yeah. So that's one of the great things specifically to the lasers that I use from Erconia. They've done 12-month and 6-month follow-up studies. So let's say like in that autism study I just told you about, they wanted to see that. Is this temporary or does it last? So they completed 8 sessions over 4 weeks, and they followed up at 6 months, and they saw that the patients were still maintaining those improvements. They did a study on patients who had chronic low back pain that was severe and a minimum of 8 years in duration, and they did a 12-month follow-up. So what was great is they did 8 sessions initially over 4 weeks, and then they saw that average patients drop 58% in their chronic low back pain. And then when they follow them up 12 months later with no additional treatment, they actually not only maintained that improvement, but had an extra 17.4% drop extra in their pain, even with no additional therapy. So that's the difference with these low-level lasers, is we're trying to actually heal the tissue, not just be something temporary that only lasts while you have it on there.
And then what does a treatment look like? Like, can you kind of walk us through what one would expect?
Sure. So let's say like if, because your listeners are just listening, they're not going to see this, correct? Or are they going, okay.
Yeah.
So basically, and you can see this is one of my handheld ones. It's about a little bigger than a smartphone. We also have some big ones too, that I can put it around a patient, like when we're doing transcranial work for concussions or neurodegeneration, or say for autism support. We have 3 lasers that will go around the head and it will rotate over the tissue, so you get a greater area of coverage. And the way the treatment looks like is literally, it can be as simple as, if you've got an injured shoulder, you just take the laser, and there are 2 different lines that come out of this particular laser that will hit the area of involvement, and you leave it on there for a period of time that might be 5 minutes or 10 minutes or 20 minutes, depending on what you're treating. Same thing with the brain. You can literally just stick it on there, and the laser energy will be absorbed by the skin, and then it's going to stimulate some of the stem cells that are in the bone marrow of the cranium, and then those will be transported through these little microtubules to the surface of the brain to get those to repair. So it can look as simple as that, or we can do more complicated things. Like if I have a patient who has like chronic brain fog, let's say I have a lot of autoimmune patients who come in with brain fog, and they might have trouble with word searching. Well, while I have the laser on them, I'm going to also have them do brain exercises for whatever is that weak pathway, to try to get them to support that pathway, because the laser is going to stimulate things like brain-derived neurotrophic factor and synaptogenesis. So you're going to make new nerve connections. You're going to improve the firing of those neurons. You're also going to decrease inflammation in the brain and facilitate lymphatic drainage. So it can be really simple. And you can see this demonstration here. You can see I've got the laser here on my head. We can do it as simple as that. If we're doing something to stimulate the vagus nerve, let's say I have a patient who has chronic constipation or difficulty swallowing, or they can only take supplements if they're liquid or powder form. We'll literally go like this, open the mouth, have the laser go right in there to the mouth and do vagus nerve stimulation. So we might have them do some gargling or stimulate the gag reflex while the laser is directly into the mouth and over the vagus nerve over the neck. And we can also do it directly over the gut to try to, support these, what we call photobiochemical changes there. So real simple. And people don't feel anything. That's the great thing. There is no heat. There's no pain. There's no downtime. And that's very unique when it comes to therapies. And patients oftentimes will feel a change in the first session, within those first 10 or 15 minutes. That's how I got the reputation of being the voodoo doctor, because people would literally get up and say, "What the heck did you do to me? How did I change so fast?"
What would a typical amount of time even be for? Is it like a quick 15-minute treatment, or is it something that you do once a week, or is it daily?
So it's good. Yeah, so it'll depend on the condition. Like, let's say if I'm dealing with a sports injury. So I work with a lot of athletes. I've worked with like the Dodgers and Angels fantasy camp, and I've had some Olympic athletes in my office and some pros and whatnot. If we got one of them coming in, let's say they just injured their knee or shoulder. I have a lot of people coming with shoulder injuries. We'll have them come in, and what I'm usually trying to do on that first visit with the laser is we're shooting to get somewhere between a 10 or a 15 or maybe a 30% improvement that fast on the laser. Obviously if it's something major where they need surgery, that's different. But let's say for your average type of an injury where someone's lifted something, let's say your listeners at home, they've lifted something and injured their shoulder or their back, we'll have them come in. The treatment will usually be somewhere between 5 to maybe 15 minutes, depending on the severity of it. And we'll usually get them to come in 2 or 3 times a week initially, with the goal of trying to get them better as quickly as possible. Let's say if you take something that on average with traditional treatment would take 4 to 6 weeks, with laser, the research says that it's usually going to be about 25 to 35% faster. So instead of 4 to 6 weeks, we might get that person done in, say, 3 to 4 weeks. If we have a fracture that, like I have a lot of athletes who've had, or even patients who are diabetic who have fractured bones in their feet. Let's say if they're told it's going to be 8 weeks to heal, we'll usually get them done in about 5. So you're looking at a lot shorter time on there. If it's where it's something that's ongoing is the autoimmune patients. So if I've got, let's say, I have a lot of Hashimoto's patients who found me from Dr. Isabella Wentz writing some articles about laser. They're coming in because of chronic stuff. So they might be coming in once a month, once every couple of weeks, or once a week, depending on where they are, and what helps them to feel at their optimum level of brain function, and what do their lab tests look like. Because you can actually see changes on lab tests as well when you do laser therapy. It's showing these changes in inflammation. You can see changes in their liver markers, their glucose markers, all these different really cool things to see an objective difference. So I know it's kind of a roundabout thing, but it gives you an idea. It's going to be about that much shorter, 25 to 35, maybe even 50% faster. But we usually see differences on that first session is what we'll see.
Cool. Talk a little bit about the at-home devices that are out there. So like in red light therapy, is that the same thing?
You're going to have the manufacturers of it will claim it's the same. It's not the same for a clinical setting. So those are fine for using at home for support. But let me give you an example. So when there are 21 different FDA clearances for the use of lasers or say red lights for patients, out of the 21 different clearances, 18 of them were done using a 635 nanometer red laser, which is a true laser device where the beams come out parallel, versus an LED. And an LED is not coherent. The laser was always shown to be superior in each of those ones. There are still effects with an LED device, but it's not going to be the same level of it. The benefits that a patient have, though, with an LED device is it's going to be inexpensive, so it's great for them to use at home. So I do often recommend to my patients to get one of those for home use in between what we're doing in the clinic. But let's say, for example, when we go back to that autism study, the placebo device was an LED using identical parameters, the same wavelength, the same energy, and they showed virtually no impact or a very small impact compared to the laser. But you can still use them at home. I know a lot of patients who will use them. There are some studies that do show some benefits with that. So you're going to still have some photobiochemical reactions with an LED device, but most of the research right now there's 50 years of research on PubMed shows that it's not as effective, even though there is one researcher who tried to claim it's identical. The study that he published was pretty flawed. He's a relatively famous guy, but he used 359 different studies he's referenced in there, but only 3 of them compared a laser and an LED device head to head. The others were just using an LED device, showing that it was effective for some things to be beneficial. So hopefully that gives an idea. I would recommend using them at home, but it's not the same as going into a clinic and using an actual true laser, especially if someone's got, let's say, head trauma or they've got something big that's going on. There's going to be a big difference between the laser and the LED. It's kind of like trying to enter a Daytona 500 race with the regular sports car, like a Ford Mustang that I used to have growing up. It's still good. It's still something to do, but it's not going to win the race.
Gotcha. That's a good comparison. And then just how about like infrared sauna? Like what is that doing?
So infrared, you're still going to get reactions in the body from any kind of light that you put on. You're going to have some type of reaction, in the body. Infrared, you've also got a thermal aspect to it as well. So a lot of people like those for detoxification. Those ones can be really good to use for that. And a great reference, someone who's really an expert when it comes to home LED devices and infrareds is Ari Witten. He really knows his stuff when it comes to those types of things. So like when people are looking for which of those units to get at home, I'd say he's one of the best sources to find out which one is a good one, because he'll even tell you there's a big difference between those devices that are good versus ones that are crap, because some of them, they'll make them very inexpensive. They'll use, lighting that costs like say 6 cents per bulb on there. So it's, not a very quality type of a thing, but you can still get benefits from that. A lot of people really enjoy using it. There are different kind of lighting things you can use if you're in a high northern latitude to prevent you from getting seasonal affective disorder. Like I have some friends who are, they live in Norway, and they're so far north that they say they've got 2 days per year. They have day and they have night. They said during the wintertime, peak of winter, they have 23 hours of darkness, and peak of summer, it's 23 hours of light. So I asked them, I'm like, man, what is that like? They said, well, in the wintertime, everybody's depressed. We do nothing but sleep all day, and we drink lots of vodka. And I said, okay. I said, so what's it like in the summer? He said, summer is great. He said, everybody sleeps about 3 hours. Everybody's happy, and we work all day and get everything done during that time. So it gives you an idea how any type of light is going to have an impact on your body. So those devices can be beneficial as well, too.
Which at-home ones would you recommend from a laser perspective, or like, again, red light, if you have any faves?
So, if we're looking, again, when it comes to like the at-home ones, I would look at, Ari wrote that book called Red Light Therapy. That's going to be the best one on there because he's more of an expert when it comes to those devices on it, because there's some that will have more research on them. When I'm using lasers in the clinic, I like to use the Erconia lasers. I do have patients who have major autoimmune issues or neurodegenerative issues. We'll actually have them buy those lasers for home use. So they can also do that. The difference is if you're using a laser at home, you have to get a prescription from a licensed healthcare provider. And then like if I have a patient in my office, we'll train them on how to use it, or we'll do a virtual training if they've bought it from afar. That way they can use it on a regular basis. So you can use those devices. And particularly if, let's say, if someone has issues with chronic infections, especially as we're talking about, say, COVID and all this stuff, lasers that have a violet wavelength in them, like the 405 nanometer wavelength, those are particularly shown to be beneficial for affecting infections like bacterial, viral, etc. A lot of research, again, going back to the Russians on that. There's a lot of research that has come out recently on showing these violet wavelengths from being antimicrobial, even against things like the norovirus, calicivirus. They also have an impact on the cytokine storms, like on interleukin-6 that can trigger the cytokine storms. These lasers of the red and the blue wavelength can actually dampen that interleukin-6 that triggers the cytokine storm. So there's some benefits even for that. So when we have pretty fragile patients at home, we'll usually recommend to get a device like that to use at home.
Is there anything people should be aware of if they are going to go to like a chiropractic office to get cold laser done, like that? Yeah. Questions they should ask, or?
Yeah, definitely. One of the things is to make sure they ask, first of all, have they done any training on it? Because unfortunately, a lot of doctors will buy devices, like whatever is the bright and shiny new thing, and they get them and they get no training, and they don't know what they're doing with it. So I have the perfect example of what not to do. I had a doctor who contacted me because the patient was really involved in the thyroid community and read the stuff that Isabella had written, and she'd had me on her show as well too. And so this patient found a doctor who had a laser up in Northern California, and this doctor was a valedictorian from her school. And so she called me up to ask me about, hey, what can we do for this patient for thyroid support? And so I said, first of all, what kind of laser do you have? And she had a high-powered device, which is what's called a class 4 device. So they measure lasers in these classes of class 2, 3, and 4. And the ones with the most research and that are the safest are the class 2 ones. When you go into the class 4, a lot of doctors think that more power is better, but particularly if you're using it on the brain for brain support or on the thyroid, those ones are very problematic because they do create a thermal effect, and there's a lot of energy going into the tissue at once. And particularly for an autoimmune patient, if you have those that are listening, it can overwhelm them. And so I warned the doctor, I said, hey, listen, you've got this high-powered, it's a 3-watt laser. So you can't use that for the thyroid. You can't use that for the brain. You're actually going to make the person worse. And she argued with me. She said, well, the representative from the laser company said it's fine. I said, I don't care what the representative says. I care what the research says. And the research says if you use a high-powered device on the brain or on the thyroid, you're going to create some problems. She didn't listen, and she used it, and she flared the patient up, and the patient actually ended up in the hospital with a thyroid storm. So that's what you want to make sure that you avoid. So if you have these autoimmunities, ask them, first of all, what's their training? Do they actually learn how to use a laser or not? And what kind of laser do they have? Because if they have the high-powered ones, the class 4, those are fine for like an arthritic patient who's got a lot of joint pain, and that's what they're just looking at. But if you have a patient who's got fibromyalgia or rheumatoid arthritis or concussions, neurodegenerative issues, or Hashimoto's, that can really overstimulate them and create a problem. So that's where you really want to go with the lower-powered device on there. And so that's what I would look for if I were
that's super helpful. And then is there anything that you see as like a rule in the space that you break, like through the way that you train doctors or that you practice, that you see like wanting to bring more truth to the use of lasers? Yeah,
that's really what I'm trying to do, because I'm all about just what's the research, what's the data say? And unfortunately, a lot of people are just about, well, how can I sell more stuff? How can I sell more patients on laser, or how can I sell more lasers to doctors? And so that's why I think it's really important. The analogy I use when I'm training doctors is that, especially here in the United States, this is something that the former Soviet Union talked about, is they said when it came to laser therapy, they found that lower power was better, less was more. And there's something called the hormetic effect, to where if you do a certain dose, like a lower dose, you'll get one effect, and a high dose, you'll get an opposite effect. And I think the easiest way to understand that is, let's say I want to stimulate vitamin D by going out in the sun. If I go out for, like, say 15 minutes to get a particular dose, now I'm going to have a nice mild stimulation of melanin in the skin, and I'm going to also produce vitamin D. But if I stay out there too long, I can look like a lobster, Or let's say if I try to do something to amplify it, like growing up as a kid in Southern California in the 1970s, we used to put baby oil on our skin and get aluminum foil and reflect the sun onto us to bake us as quickly as possible. Mm-hmm. And so we now know that, that more power is not necessarily better. Or the analogy I use to when I'm teaching doctors in the seminar is I ask them, hey, do you guys don't remember that show Home Improvement? You remember that one with Tim the Toolman Taylor? Yeah, exactly. And so I would say, well, remember anytime Al would show Tim a new device, Tim would say, hey, Al, you know what this thing needs? It needs more power. Oh. And he would, soup that thing up and make so much power that he'd either blow it up or start a fire. And Al had to, put it out and then correct it. And he'd always tell him, no, Tim, you don't need more power. You need the right amount of power. And that's a key thing, because the studies actually show if you come in with more power or a higher dosage, you can actually get zero effect or a negative effect. It's like once you cook a roast or a barbecue, when it's done, it's done. And if you go too much, then you've now made it tough and the tissue's different. So that's a real important thing for people to understand.
Yeah, that's awesome analogy. I love Home Improvement. I had a huge crush on Jonathan Taylor Thomas.
So many people did. Yeah. I do have one, if I can add one or more story, if we got time for that. Yeah. Please. So a lot of people, when they look at laser, they think, okay, what if this is just a placebo? Because I've had that happen where people come in and they get such a fast change. They're like, okay, hey, well, this might just be a placebo. What kind of mind trick, Chris Angel, mind freak did you do on me? I think one of the best stories that I have, there's two relating to animals. There's one that patients can go on, they can see a video online if they go to just Google search TLC Pets with a Z and the name Lucky. They'll see my friend, he's a laser veterinarian, Dr. Juan Casillas, and he's over right by my office. He had a dog who got hit by a car, and Lucky got brought in and he was paralyzed from the waist down. And you can see it on the video. The owner drops him off and wants to just put him to sleep. And Dr. Casillas looks at him and says, hey, I can fix your dog. I can do lasers and I can use some chiropractic tools on him, and I can get him walking again. He'll be fine. The guy asks him, well, how much is that going to cost me? And Dr. Casillas is blown away. He's like, well, it's going to cost you, X amount of dollars. It's going to take, about 4 sessions to fix him. He's like, well, how much will it cost me to put him to sleep? He's, well, that's like $100. No, I just want to put him to sleep. And Dr. Casillas is blown away because he's like, I can save this pet. So he tells the guy, he said, listen, what if I adopt your pet? I'll work on him and then I'm going to rehome him afterwards. Are you okay with that? And the guy says, well, what's that going to cost me? He says, well, it's not going to cost you anything because I'm going to, take him in myself. Okay, that's fine. The guy leaves. And so you can see on the video, Dr. Casillas starts using the same lasers I use from Merconia, and he uses an adjuster tool. And Lucky goes from being paralyzed on day 1 to on day 4, he's running. And you can see him trotting around. So there's no placebo with the dog. And he adopted him out to a new home. So Lucky definitely was very lucky, coming into Dr. Casillas.
He put his name.
Yeah, he did. And the other story was with my cat, because my cat Poopsie. He was a really big, fluffy Maine Coon, just a giant, looked like a bobcat. He was great. My wife and I don't have kids, so he was like our fur baby. Mm-hmm. And I had already been using lasers for 4 years, and I'd seen some amazing things. But still, there's a bit of skepticism too. I was wondering, well, how much could this potentially be placebo with my patients as well? So what happened was my wife and I came home one weekend, and we had been out. We'd gone to the local casino here, had a great time, and we come back in. And do you have pets, or have you had pets before?
Yeah, I've
dogs. So with pets, have you noticed they never get sick during normal vet hours, right? It's always on the weekend or after hours. So Poopsie was famous for that, or on holidays. So we come home, it's like 11 o'clock on a Saturday, and he's limp and he's kind of unresponsive. I scoop him up and we rush him to the emergency vet, and I take him there and I set him down. And, we're both freaking out. We've had him for 11 years. And the vet looks at him and says, oh my gosh, your cat looks really sick. Let me take him back and run some tests. I said, okay, fine. So he takes him back and he does blood work and he does an ultrasound over his pancreas. And he comes back and he tells us, we have some bad news for you. Poopsie's got acute necrotizing pancreatitis and his immune system is destroying his pancreas. We don't have any treatment for this. We recommend that you put him to sleep. And my wife and I are stunned. We had just had this wonderful weekend, and now all of a sudden it's 180 degrees in a different direction. And I'm like, well, there's got to be something you can do. He's like, no, we have no treatments for it. So I asked him, I said, well, look, I don't want to put him to sleep just yet. I said, I'm going to take him home. I'm going to do my lasers on him. I said, I work on humans with lasers. I've seen some amazing things, cases you wouldn't believe. I said, I want to try to do the same thing with my cat. Of course, he rolls his eyes and he's like, oh my God. He's like, there's no treatment for this. I said, okay, well, I'm going to take him home anyway. What do I need to watch out for? He says, all right, well, today's Saturday. He said, I don't think he'll make it till Wednesday. He said, by Wednesday, he'll probably be yowling. He won't want to eat. And you have to bring him back in at that point to put him to sleep. That'll be it'll be cruel if you don't. I said, okay, fine, deal. If he's not doing well, I'll bring him back. So I take him home. And I have this manual that has these different frequencies that create like a resonant frequency with different tissue to try to stimulate some tissue regeneration. Some of it's based off of research the Russians did. Some on this other gentleman named Royal Rife, who found resonant frequencies in different tissues. So I start using it on some frequencies to stimulate the pancreas. And I started using it twice a day for about 3 minutes each time. Wednesday rolls around. Instead of him yelling in pain and not wanting to eat, he had a voracious appetite and he's starting to move and get around. I'm like, hey, this is cool. Poopsie looks like he might be back. He keeps getting better. I take him back on Saturday for the follow-up, and I set him down in the vet's office, and the vet looks at him. He says, oh my gosh, your pet, he looks surprisingly good. But he said, but don't get your hopes up. We're going to do objective tests. We're going to run the labs. I'm going to do a follow-up ultrasound. He had 90% destruction of his pancreas. If it's any worse, we really recommend the humane thing to do is to put him to sleep. I said, fair enough. We'll look at objective data. So he takes him back, and there's that little hole in the window, little glass that I can see him through as he's looking at the results. And I see him looking at the ultrasound, and he's scratching his head, and he's comparing the pre and the post, from last week and this week. And I see him call over another veterinarian, and they're arguing and talking about the films. And he looks at me and he waves me in, and I open the door and come through, and he says, what the hell did you do? And I said, why? What's wrong? He said, no, nothing is wrong, but what the hell did you do? He said, look at these films. He said, we had to make sure we had the right films. He said, literally last week, it was the worst pancreas we'd ever seen. There's 90% destruction. We all talked about what an a-hole we thought you were for taking him home and thinking your magic lasers were going to heal him. He said, but you just proved us wrong. Look at this film over here. This is a week later. You just regenerated 80% of his pancreas. He said, it's 90% of normal. He said, he said, that's normal for an 11-year-old cat. It's like, what the hell did you do? And so I said, well, look, I used my lasers on him. So needless to say, that veterinarian afterwards signs all over for laser therapy. They're doing laser therapy for animals.
That's so
and
cool.
it gets even better. He tells me, he said, okay, the good news is he's out of the woods with the pancreatitis. The bad news is he's diabetic now, and he's going to need about 4 units of insulin twice a day for the rest of his life. The double bad news is he will only live about 1 year to 2 years, because cats will only live about that long when they're diabetic, because eventually the insulin doesn't work anymore. The other bad news, he said, is they need human insulin, and it's expensive. You're looking at about $125 a bottle. That's up to like close to $600 a bottle now. But back in 2008, it was $125. So he said, you're going to go through about 2 to 3 bottles a month. So you've got like the $6 million kitty here. That's going to be expensive for you. So he said, you're going to have to test his blood with his paw and give him a dose appropriate to what's going on there. So I'm like, okay, that's fine. I'll do anything for my cat. So what I did is I continued to do laser on him. We also switched his diet like we would on a human. We got rid of the processed grain type of food, went to an all natural kind of, carnivore diet for him. And what happened is over time, he needed less and less insulin. When I would test him, there were certain days he didn't need any insulin. And we got him down from not 4 units to 3 units, then to 2, then to 1, to where eventually he only needed about 3/4 of a unit, usually once a day, sometimes once every couple of days. And he lived not just 1 or 2 years, but an additional 6 years to the age of 17.
Oh my gosh, that makes my heart so happy.
Yeah. So Poopsie was my laser miracle. That is the thing that says there's no placebo. And an extra 6 years with your pet. I mean, that's totally worth it.
Well, Dr. Kirk, where can people find out more about you and your work and even your trainings?
Sure. So they can go to my website, which is laser, that's with an S, laserchiropractic.net. That's where they can find out more about me. I also have a YouTube channel, youtube.com/Kirk Gair, where they can see videos on there. And I have on Facebook, I have a group page for people who are interested in trying to connect with providers or trying to learn about laser therapy, which is just, if you type in Dr. Gair's Patient Health and Performance Secrets, that's where they can go. I also have a free download for people I'm also a musician. So I created a guided meditation with music that I wrote and recorded, and I recorded 360 degrees surround sound ocean up near Santa Barbara. they can go to reverbnation.com/Kirk Gair DC, and you can download the free guided meditation on there for more stuff.
I'll definitely put that in the show notes. And just thanks so much for coming on and inspiring us with a different way to break some rules in our own health journey.
Well, thanks for having me. I appreciate it. People can really change their life with these things.